We are now joined by Dr. Ashish Jha, the director of Harvard Global Health Institute. Dr. Jha, good morning to you. Let's talk a little bit about these numbers. The death toll in the United States now tops 120,000. We have 25 states seeing an uptick, surging numbers in Texas and Arizona and in Florida. And I actually read this article that said Texas Children's Hospital is now opening its beds to adults so they can free up other beds for COVID patients. So how do you account for the uptick in these numbers, and do you think we're ready for it?
Yeah, so good morning. Thanks for having me on. You know, about a month and a half ago, the president's own task force laid out criteria for what states should use before they open up. And a good number of states, many of the places where we're seeing spikes, ignored those criteria and opened up when the case numbers were high and they were not coming down. And so in many ways, this was expected. So as upsetting as it is to see these cases, it's not surprising. And the question now in front of us is, what are we going to do to really try to curtail these spikes so that our hospitals don't get overwhelmed and we don't find ourselves having to shut down again? That's the thing we all want to try to avoid. And I'm worried that we're not taking it seriously enough.
Well, let's talk about curtailing it, because one of the big issues is masks. I mean, some people wear them, some people don't wear them. People are getting in fights over them at like a Walmart. Some people don't want to wear them on planes. Do you think there should be kind of a national standard for mask wearing?
Yeah, you know, we're in the middle of a pandemic and people are bringing up, people want to have freedom to not wear masks. Now, I understand sometimes masks can be a little uncomfortable, but the bottom line is that we know that masks reduce infections and they save lives. And just as, I can't walk into a retail store and light up a cigarette, I shouldn't be able to walk into a retail store without wearing a mask. These are basic public health measures that I think should be implemented across the country. It's not that inconvenient. And if it helps us stay open and avoid our hospitals getting overwhelmed, it feels to me like it's well worth the cost.
I think a lot of people are wondering, what if I do everything right? What if I wear a mask? What if I wash my hands? What if I take all the precautions? Is it cool that I go out to a town and go shopping or go out and about? Would I be okay in that instance?
Well, there is no such thing as perfect safety. All you can do is reduce your risks. But if you're wearing a mask, if you're washing hands, and if you're in a community that's not having a large outbreak, then yeah, going out and about is a reasonable thing to do, but still worth maintaining social distancing. And when you go into a retail shop, not spending large amounts of time in crowded indoor spaces, if you do all of those things, I think your risks are pretty low. But the biggest factor is how big of an outbreak do you have in your community? Mm-hmm. And so for everybody, the key is make sure that your political leaders are doing everything they can to keep the level of virus down in your community.
And quickly, I just want to ask about this one other headline. The number of young people, the cases in young people is spiking. How do you account for that? And what's the real concern if that's the case?
Yeah, so I think a lot of it is because when places opened up, the bars and restaurants and nightclubs, it's more often frequented by young people. So they're going to be the first ones to get infected. Some people would like to say, well, that's not a big deal because young people don't get us sick. Now, that is true, but young people are then going to go spend time with their parents and grandparents. And so I'm very concerned about this. And just because it starts with young people doesn't mean it'll stay with young people. We've really got to curtail infections across all age groups.
All right. Dr. Jha, thank you for your insight. We appreciate it.